I walked every day. I played tennis probably every day. I started to practice yoga really when my knees started to fail. I lived with ice wrapped around my legs, but I kept pushing. I couldn't walk steps. I couldn't walk to the corner. I couldn't shop. When I was in the supermarket, I literally laid on a shopping cart. But it was getting to the point where trying to survive a day was difficult. I mean, I just wanted to sit. I used to think about every step that I took, whether I was in the house or I was in the store. I used to get angry with my husband if he caused me to take 2 more steps than I needed to. My temperament was from dealing with pain. Pain drags you down. And I know that I could not have continued that way. In my investigation, I learned about minimally invasive quad sparing. And it just made sense that if they didn't cut your quad muscle, if they didn't get in there and cut it, that you'd be able to use it more for physical therapy.
Hello.
Hello, how are you?
I'm good. How are you, Suzanne?
The criteria I was looking for was a doctor who would perform minimally invasive quad sparing, who would do both knees at the same time, and who had experienced hundreds, not 100, many hundreds of patients that he had done this procedure on. Dr. Lahner offered that. I mean, I read so much about him and his experiences, and I felt confident that together we would do a great job with me. I went into the hospital on a Friday. The surgery was on a Friday morning. Monday I went into acute rehab, and on Saturday I came home. Within 24 hours of the surgery, I was out of bed and standing on my feet, and I never felt my feet so attached to the earth. I couldn't believe how I was steady and standing really attached. And then I opted to go to their acute rehab. When you have bilateral, they recommend that you go to an acute rehab and not come right home. And it really was wonderful. They did a great job with me. I was in physical therapy every day for many hours, 3 hours a day, and there was some occupational therapy too involved in learning how to shower and get dressed. And I left acute rehab on the 8th day after my surgery, and I actually went food shopping on the way home from the hospital to make sure there was the proper food in the house. I was finished with physical therapy at a little over 6 weeks, 6.5 weeks out of surgery. And at that point I started to work in the gym with a trainer. I started to practice yoga again. I was getting out. I was doing things in the house. I still found then that I needed to rest a little bit in the afternoon, but I would say my life was pretty normal then. Oh gosh, I can do everything. I feel 20 years younger. There's nothing I can't do that I want to do. And I do water aerobics, I'm in the gym constantly, I walk, I can spend a whole day shopping. The procedure is so simplified over what it was years ago, and what it offers to your life. I mean, we're all going to live for a long time, a lot longer than our parents did, and you want quality to that life. And that's what it's given me.